Hey guys, you're watching the Best Practices Show, where we take a look at the best business practices from the best dental practices all over. And if you're growing a great restorative practice, you know what the challenge of insurance can be to your overall health and sanity. And today I've got my good friend Laci Phillips on. We're going to be talking about how you can be in patient focused in an insurance driven world. And she is fantastic with this. So you do not want to miss this. So do me a favor, grab a pen and hit the share button. We'll see you in a second. Hey guys, you're watching the Best Practice Show. Thank you so much for tuning in, and so grateful for all of you that are watching now. Up over 21,000 followers on Facebook and over 50,000 on iTunes. Just crazy. So loving the feedback. And again, we're in the second season and trying to keep up with all the requests that you guys are asking. A lot of requests come in for insurance dynamics. Now, I've got an expert on today, and you don't want to miss this. But before we get rolling, couple show notes. We are shooting this particular episode live on Facebook. So as you have a question, or if you have a question, add it to the feed, and I'll ask Laci directly, and we'll get it straight from her while she's on here. Or if you have questions later on, continue to add them to the feed, and we'll get back to you, because we want you to get the most out of this while you're improving your practice. Now, my guest today, I've gotten to know you, Laci, over the last couple of years. I've watched you grow and develop. You've got an amazing opportunity with your company, and you're also a fellow member of the ADMC and the consulting group. I enjoy being around you. I learned so much from you, but people don't know who Laci Phillips is. Can you share with us a little bit about who you are?
Absolutely. Hi, by the way. Kirk, look at you with like 70,000 followers all over the world.
Yeah, I don't know. I'm not that smart. I just surround myself with smart people. How's that?
That is smart. That's the smartest thing you can do. So tell us about us. Bonnie Pugh and I started Practice Dynamics about 5 years ago. Bonnie's in Florida. I'm in New Mexico. We've been in the industry a combined 80 years. Is that right? No. Something like that. I don't know, 40, 50, 60, 70 years now. Tons of experience coming from being team members in the dental practice, consulting, working with clients all over the country. We just are passionate about affecting change. And as long as we can affect change and help doctors and team members become more effective and efficient, we're going to keep doing what we do.
Yeah, well, you're doing a great job. So let's talk about this issue with the insurance dynamics. Now, you and I were talking before we got started. This is a very hot topic in dentistry. And can you tell me or tell our viewers why this is so hot?
Because we live in an insurance-driven world. It's what we do. We're driven by medical insurance. As Americans, we think dental insurance is exactly like medical insurance, so they don't understand, patients don't understand why it doesn't pay 100% of anything, or why can't I just give you a 20% copay, or the worst one of all, send it to insurance and then let me know what I owe you afterwards. We live in an insurance-driven world. And so the question pops up all the time, and it's the way we've always done it too, Kirk. Remember, we talked about this before. Our favorite saying in the entire world is, it's because it's the way we've always done it. Mm-hmm. But that doesn't mean it always works for us. So we have to find a way as dental professionals, especially in this very exciting time in dentistry, we have to find a way to become patient-focused in an insurance-driven world.
Yeah, absolutely. Now, you've got a very cool 3-step process to this. But before we jump into it, one of the things that you and I both believe in is you got to get the team involved, because oftentimes the dentist gets really upset about this, but they don't include the team in the dialogue around the thinking, right?
Absolutely. Unfortunately, our teams are the ones who drive the insurance conversations. And maybe they don't realize that they're doing it. They're the ones that hate the insurance the most. They have to deal with it. They have to figure out, what is the patient going to pay? Can we do this today? But if we really sit down and look at the dialogue, we're the ones driving the conversation. That's good news. The good news is we are the ones who can change the conversation. We're the ones who can change the course of the conversation and educate our patients, but we have to have team buy-in.
Absolutely. Now take us through the 3 steps, because these are really, really good steps when you're looking at changing the way your team thinks around this. So, take us through the first one.
So what did we say step number 1 is, Kurt?
You said the whole, okay, I'll remind you. The overall is just really helping your team understand the patient focus instead of being insurance driven and what that means behind it. And some people even, I understand this, is really getting clear about the nuances of even your language, because a lot of people say don't use the word insurance. We're going to use the word benefits. We're going to help people understand that just because you have some type of an insurance, it doesn't accept it as full payment. So can you go into that? What do you guys do in helping a team understand being more patient focused?
Well, I think it's okay for us to talk about insurance. I think we have to. It's the way we do it. It's the words that we're using, right? So dental insurance is completely different than medical insurance. Yes, we say benefits. We never say the word pay. Like the very first thing I want everybody to take out of their vocabulary is insurance will pay. It will assist you with.
Right.
Phone slips. We talked about this at the last podcast. Phone slips. Second question we ask is, what insurance do you have? We have to stop doing that. We should be finding out about the patient. What are the patient's needs? How did they find out about us? Why are they coming to us? And the last thing we talk about is the insurance. It's really important for us as dental professionals to make sure that the patient is healthy. That's what we should be talking about. How do we get you healthy? How do we keep you healthy? And then we have experts in the office who will help you make this a part of your lifestyle. So then we're going to talk about finances and insurance after that. And it's okay in the very beginning to say, look, I understand how you're going to pay for this is a concern for you. It would be for me too. What I want to talk about first is the fact that we are dedicated to making sure you're healthy. We're dedicated to making sure that your health is good and you're okay. Our second commitment to you is to help you make this a part of your lifestyle.
That is awesome. That is awesome. 2 things. I love how you say this is, number 1, and I think you would agree with this, is that you don't want to let patients know that insurance is bad or have that come across. You're actually an insurance-friendly office. Now, here's the difference. A lot of team members, and I know you see this, when we go into an office, sometimes the dentist is like, this insurance drives me crazy, and then the team member will use the word insurance 6 or 7 times in the new patient telephone call. Well, do you know what your insurance is? Do you have a copy, of the card? Can you let me know what it's all, blah, blah, blah. And by the time the phone call's over, you're thinking, well, I better get some insurance. You know what I mean? And so what you're saying is just hold off, get a chance to learn a little bit more about the patient, let them know our first concern is you. And we'll definitely help you with your insurance once we get a chance to know you and find out how this, or if this can work.
Right. So sometimes the second question the patient asks is, do you take my insurance? I get that. I understand it. Address it and move on. So what I would tell the patient is, we are a very insurance-friendly office. We work with almost every single insurance company that is out there. But before we talk about your insurance, I want to find out more about you, what your needs are, why you're calling our office today. I want to tell you about us and how we can meet those needs. And I promise you, before we get off the phone today, we're going to talk about insurance. But let's talk about you first. So I'm totally turning it around and making it part of the patient conversation. Number 2 of this, Kurt, goes, what if you are out of network? There is this lifelong conversation about how do we tell patients we're out of network? And so we just don't, or we have these verbal skills that are a little misleading. They're a little bit like the patient gets off the phone and they're questioning, okay, are they in network or are they out of network? Just be honest with them from the very beginning. And say, when you're into the insurance portion of it, you're going to say to them, we don't actually have a signed contract with your insurance company. You do. However, our commitment is to maximize the benefits that you've been given in our office. Let me tell you what this means, okay? Anything that you used to receive that the insurance would pay 100% of, they're probably going to do that in this office as well. For example, exams, x-rays, your appointments with your hygienist. Anything like a filling, a root canal, maybe some periodontal issues. If you've ever been talked to about periodontal issues, there you might see about a 20%, 10 to 15% increase in what you would pay out of pocket in our office. And anything that's major, such as crowns, bridges, partials, dentures, or implants, you might see, again, a 20 to 25% increase out of pocket because we don't have that signed contract. What I need you to understand the most is, again, we are committed to making sure you're healthy and you can afford it. So we have options available to you outside of what your insurance has given you.
Yeah, absolutely. And to your point, not to mislead the patient, because there are a lot of trains of thought out there. Mislead the patient, get them in, and then patients can get really upset with you if they're thinking you're going to accept it as full payment, right?
Right. There's this whole, I read this entire article on, which was weird to me. I saved it because it just blew my mind. How to tell the patient you're out of network without really telling the patient you're out of network. And I thought, how weird is that? Like, just be honest. Just let them know. We don't have a signed contract, but it doesn't mean you can't come here. Right. The contract is always between you and the insurance company. Always. Mm-hmm. But there are some companies that will pay more or less. You know, if truth be told, and if we did a survey, Kurt, insurance companies tend to reimburse at a higher rate when you're out of network.
Interesting. Very interesting. I would believe that to be true also. Yeah.
They don't want you to know that because they want you to write off all of this dentistry. They want you to write off all of this business. But we have several offices and insurance plans that reimburse at a higher rate because we're not in network.
Very interesting. Yeah. So, well, cool. Now, number two, you'd mentioned we've got to give our team great verbal skills, and that feeds perfectly into this because, you know, my feeling is that when you put somebody in this role, the critical role of answering your phone, they represent your entire business, and they have to have the training and the confidence. Giving them a script and saying, go, here you go do it. That's a tough position to be in as a team member. So if you're a team member watching this, I totally understand that. You have to have really good training and thinking around the verbal skills. And what are some of your thoughts around the verbal skills these team members have to have?
Well, I think before the verbal skills is the education.
Okay.
I mean, the team has to understand we are not an insurance-driven practice. We are a patient-focused practice. So our number one responsibility is to do what the patient needs, is to fit the needs of what's been diagnosed. Diagnosis is not a word we use enough in dentistry. The diagnosis is the why. Why are we going to do to this patient what we're going to do? That's a diagnosis. We need to have that in our every single day, every conversation we have with the patient. Not, we're going to do a crown. Yeah. Why? Why are we doing a crown for this patient? Okay. So the very first thing is education, making sure that the team has buy-in. We're going to do what we need to do for the patient first. And the second step is figuring out how they're going to pay for it, how to make that a part of their lifestyle. So number one is the education. Number two are the verbal skills. You know us, we have a whole 50-page document on verbal skills, but it's a foundation. Take the verbal skills, look at it, what makes sense to you, and then use your own words for it. But I guarantee you, the more you educate your team, the more the team is on board with your vision, they'll come up with their own verbal skills.
Absolutely. And they have to come naturally from you instead of just reading them off a sheet of paper. Now go back to the diagnosis thing, because I love what you said. Why do you think people don't talk about diagnosis? Are they fearful of how the patient's going to react? Why doesn't this become a regular part of dialogue between team members and patients?
Because it's the way we've always done it.
Oh, that's not a good answer, though. I don't like that answer. That's
no, if you think about it, though, when you go into a medical office, they diagnose. You have a broken arm. We're going to cast it. We're going to have to do surgery. We're going to put a rod in it. They diagnose. In dentistry, we're great at putting the diagnosis in our clinical notes. We're not great at communicating that with the patient.
Yeah.
So we just have to change our mindset a little bit. And also, oh, by the way, if you look at the current ADA claim form on the bottom lower right-hand corner, there's a place for dental diagnostic codes. It's coming. They're going to make us start using dental diagnostic codes. So we need to get used to it anyway. Mm-hmm. You know, it's the way, really, truly, it's the way we've always done it, but we've got to change it. We have to start using the word diagnosis.
Yeah, and I don't know who said this, but I heard this a long time ago. Diagnosis is neutral. It's not accusational. It's not harmful. It's just neutral. I'm telling you, or the doctor's going to tell you what they see, and that's it. And
I love that. I steal that, because you're absolutely right. We're not here to shame you. Right. Oh, you need 3 root canals. No, I'm not here to shame you. I'm here to help you understand your health, what our office can do to get you healthy, and then, you know I'm being redundant with this, but then making it a part of their lifestyle. We don't say, I hate this, Kirk, I hate this, whenever team members say to me, well, insurance won't pay for that. It makes my head want to explode. I don't care what insurance will pay for right now. I care about taking care of the patient.
Right. Right. Absolutely. And however you say it, it's got to come across in a way that you say to a patient, hey, look, all of our treatment plans are based on the health of our patient and maybe not on the limitations of your benefits. So there's a significant difference here on how we present fees. Now, another thing that you mentioned earlier that I absolutely love is once you have the verbal skills, you've got to have a way to communicate it back to the patient. Once you're communicating it to, you've embraced the patient. How do we communicate it back to the patient? And what do you mean by that?
That's where the verbal skills are going to come into play. So we've educated our team. Now we want our team to be passionate about helping the patient understand, right? This is kind of what renews my passion in dentistry every year, is my challenge, my goal to educate and to help the patient truly understand dentistry is just as important as getting your annual pap smear or mammogram or your prostate exam. None of them are fun. Yeah. But they're all necessary, right? So this is I feel like we can rejuvenate our team members again, our business team members, our chairsides who have been doing this for 20 years, the dental hygienist who feels like, all I do is, I'm the queen clean. No, get passionate again, get excited again about educating the patients why this is so important. Oral systemic health tells us every single day what happens here affects every single other place in our body. We know about pre-diabetes. We know that it can cause strokes. We know cardiovascular disease happens here first a lot of the times. Let's get passionate about that again. Let's educate our patients and take this crappy, yucky, gross insurance out of play.
Yeah, absolutely. And sometimes this is absolutely the direction you have to go if you're going to move in this direction. And a lot of times dentists don't know what to do when this stuff starts to bobble up. And so I'm going to encourage you, if you're a team member watching this is the greatest thing you can do. The things that Laci is talking about, sometimes we don't have a chance to really sit down and learn about them in real time. So keep a stack of 3x5 cards right next to the front desk. And when a difficult question comes up, you're like, gosh, I don't know, that is a tough one. Write it down and then give it to the doctor or post them on the board so that we've got tools so that we can actually have verbal skills. We can all get in sync about this, because I'm telling you, if it's a difficult question, it's going to happen again and again and again. And some of the most difficult questions get asked 5 and 6 times a day, like, how much is your crowns? Do you take my insurance? I mean, every office, no matter what their vision for dentistry is, they get these difficult questions. And my question to you is, how well are you prepared to answer them?
Create your own verbal skill document.
Right.
Exactly doing what you just said. I love it. You start with, how do we answer the phone? It's just a basic. Do we answer the phone the same every single time? So then how do we answer those questions? In the phone call, the clinical team, the hygienist, the entire team needs to be on the same page with those verbal skills. Start with the basic stuff. Again, this is a foundation of how to say, what to say, when to say. It's not read it, right? It's not read the script, but it gets the entire team on board so that we all know we're saying the same thing. If we're repeatedly saying the same thing to the patient at the business office, the clinical operatory, and back at the business office again, they're going to believe us.
Yeah, absolutely. What other things do you think about when you look at the future of dentistry and some of these young dentists that are watching this when it comes to insurance? What else should they take in mind as they look forward to a great future in dentistry?
Please don't think you have to come out of dental school and sign up with 58 plans. Please. Read your contracts. I am amazed at how many dentists don't actually read their contracts. You have to read those things. You're signing your life away.
And keep them. Read them and keep them.
On site.
Yes.
On site. I will tell you, so here's a few things to look at when you're reading your contracts. Is it auto-renewable, or is this something you have to revisit with the insurance company every certain amount of time?
Wait, pause, go back to that. Explain why that's important, because that's huge. This
is important because you may think that you're signed up with an insurance plan, and you're not.
Yeah.
You've been writing off 47% of your services, and you don't have to, and you're, oh, by the way, you're not compliant anymore. Right. Read your contracts. Second thing on that is how do you handle non-covered services? In every single contract, there's a little amendum. You know, there's like a Roman numeral, and it says uncovered services. Best case scenario, you get to collect from the patient what is not covered by the insurance company. If it's denied, it's just not a covered service, whatever. Worst case scenario, you have to write off any uncovered service. Do not sign that contract. That's terrible.
Because that's not insurance. That's prison. You know, you can't. Prison. Well, when you really think about it, you don't have the ability to make any choices with patients at all about their health. I mean, you can, but not within the scope of your practice when you're contracted. So that is a very important point to notice in your contract.
Third thing, oh my God, my brain just totally went blank. Oh, see if they're negotiable. You can always negotiate your contract before you sign it. Not only can you negotiate your fees, you can negotiate your contract before you sign it. So for example, if everything looks good in the contract except for your uncovered services, negotiate to get that back in there.
Because a lot of times it's getting harder to do this. Would you agree? I mean, dentists used to be able to submit letters all the time and they would close the gap between gross and net production. But you still have to be consistent with this because, like you said, everything is negotiable. There are some that you can negotiate with.
We just did an insurance analysis in Indiana 2 weeks ago. Our client was writing off 47% from one particular plan. Okay, so let's take this into consideration, Kirk. Let's say you have 65% overhead to keep your business running, which is healthy. 65% is healthy. Okay, so 65% is going to go to keeping the office open, doing payroll, keeping things in the office, overhead. Then your insurance company asks you to write off it. They don't ask you. They tell you to write off an additional 47% that you're just giving away. Then let's just take into consideration. Let's just say you're an office that doesn't ask your patients to pay at time of service. You've seriously just lost money.
Yeah, it costs money to go to work under those circumstances.
It does. It does. Absolutely. So don't feel like you have to sign up with every insurance company, and be careful because there's more umbrellas going on now than ever. You sign up with one, there's 5 other companies listed underneath that. Be careful of that. And then the final thing I would say is do an insurance analysis every 12 months. This is how we do it, okay? We get all your insurance companies, we list them out there. What is your gross production, write-offs, net production from this insurance company? Here's what I'm also going to look at. I'm going to see how many new patients did I get this year from this insurance company, and what's my retention rate? How many of them are still patients?
Yeah, absolutely.
Because so many times everybody goes, well, we get a ton of new patients. Do you? Do you get a ton of new patients? And are you literally paying them to get their dental work done?
Yeah.
Yeah.
It's one of those things you have to pay attention to. And then I would also add this: if you're a young dentist watching this and you haven't purchased a practice yet, just because the dentist you're buying the practice from is a premier provider does not at all mean that you're going to be a premier provider. And that's a big problem. Would you agree?
Oh, I would agree. Just an example, I worked with a dentist in Oklahoma, and I asked her to have all of her contracts on site so I could review them. There were 7 contracts. She was not listed on any of them. It was the dentist that she had bought the practice from. They had sent in all of the paperwork to get it turned over to her, but nothing was ever back. She never signed anything. So for 2 years, she was working under the assumption she was a preferred provider for these 7 contracts.
Oh my goodness.
Yep.
So that's very, very dangerous. So make sure you read your contracts, understand them, and understand the implications long-term of them. And Laci, I know we only have you for a short time because you got to run to a soccer game. I'm just so grateful for even this amount of time. And you and I are going to do a bunch of others on other aspects of the practice. So Laci, if somebody's watching this, they want to reach out to you and get in touch with you, how can we get a hold of you?
Just put out your Batman signal. I will come. No, I'm kidding. You can reach me at the website, of course, which is practicedynamics.net, Facebook page, Practice Dynamics group, or you can reach me my personal email, Laci, Laci.Phillips at practicedynamics.net.
Awesome. Well, thank you so much for being on, and just stick around for just a second while we say goodbye to everybody. Thank you guys for watching. Hope you found this valuable. If you did, do me a favor, hit the share button, share it with your friends, and keep giving us feedback on things you want to see in upcoming episodes. And we hope you guys have a better practice and a better life. So until we see you next time, keep watching the Best Practice Show. You guys have a great evening.